Welcome to AARP, Arizona Hispanic Connection. Educate. Celebrate. Connect. Arizona Hispanic Connection.
Welcome to Arizona Barrio Stories on Latino USA TV. Welcome, welcome. Welcome to this show of fun and laughter and information. We have today with us David Parra Luna. He always has good information for not only for our crew, but for you too. So grab paper and pencil, and don't forget, always do your research. David, welcome to AARP, Arizona Hispanic Connection. Salud, dinero y amor.
Thank you. Thank you, Irma. It's my pleasure. It's not fair that I have so much information. Of course, I work for AARP. At AARP, we have a ton of great information, actually. Among the various things that AARP offers the community and members, I value the most the information that we have on different topics. So we strongly recommend folks to visit our page, follow us on Facebook. They can find us anywhere, right, on social media and our website. We have lots of information. Well, today, Irma, last show we addressed open enrollment for Medicare. Let's address open enrollment in the Affordable Care Act, which is the name of the law. They used to call it Obamacare. Now I think it's kind of like adopting a new name, and it is the Health Insurance Marketplace. I think that's the name that is going to stay. I was wondering what name was going to be the last one, because I know that a lot of people don't like Obamacare, right? So probably the Health Insurance Marketplace will be the name, I think. And there's so much that I can say about this topic, because when it first became law, I was one of the first persons who was running around in English and Spanish talking about this law. It was very controversial. I think people understand that. And then over the years, there's been attempts to undo the law. But I believe if my numbers don't fail me, we're in the neighborhood of around 50 million people. I think it's 50 million. I hope I got this right, that have insurance in the marketplace. So just picture that amount of people not having this option. What would they do without health insurance? Let's also keep in mind that subsidies are given with folks of lower incomes, so that money is tax money.
So that's available.
Well, that is money that the government has to invest, and it has to be renewed, and so there's always that issue of whether in the future we could have issues or not. But I just want people to be mindful of this, the system. So let's get into the details. We are going to talk about the open enrollment, but we'll leave that towards the end. Let's just say that when this was first established, the number one thing that we want to highlight is that health plans in the marketplace have to include 10 essential health benefits. 10 essential health benefits. Obviously, doctor visits, emergency, hospital, maternity, mental health, prescription, rehabilitation, laboratory services, preventive and pediatric services, including oral and vision care. So those are the 10 essential health benefits. That is important, and that's what every plan now has to offer. So that was extremely good. Another thing that that this market, because remember, this is a market that was built that did not exist. And one of the things that amazes me is that people can go to healthcare.gov or cuidadodesalud.gov and shop for insurance as you would in Amazon. You know, when you go to Amazon,
when you think of a marketplace,
you start looking at the details and you start purchasing whatever works for you, right? Same thing with the healthcare marketplace. It is, to me, amazing that the government was able to establish that. And when people, they first have to create an account and then shop for the plan that of their choice. If not, they can find an agency that helps people with this kind of, purchasing or finding insurance. But one of the things that we want to highlight is that in the marketplace, there are 4 levels of coverage, and I'm going to simplify it: bronze, silver, gold, and platinum. And the main difference of these levels is 90-10, 80-20, 70-30, or 60-40. That is the cost sharing in percentage that the insurance company and the cover person will share. The lower percentage is paid by the member, and the higher by the insurance company. So they have 4 levels. I do not have 4 levels of coverage in my work, and I venture to think that no one in the group, market has it. I don't think you have the 4 levels on Medicare. So this is the only place where you can find 4 levels of coverage. So if you're relatively healthy and you don't want to have pay too much on premiums, well, you get a 60-40. And not only that, they also sell catastrophic plans. Those plans are going to have a very high deductible just in case of a major happening, right? That will require thousands of dollars. Otherwise, you pay a lower premium and you're all set. From the get-go, I have to say that now, if you don't have insurance, there are no penalties. There used to be. You used to be penalized for not having insurance. That's a thing of the past. So how does that sound, these levels of coverage to you?
In my mind, I try to put myself in other people's shoes, and I'm wondering, what does a person do if, say, tomorrow they lose their job and they have no health insurance for them? Yeah. I think, looking at this, I would really have to spend time, like I tell people, do your research. What will benefit you in your situation? Like you said, are you relatively healthy? Do you have health conditions? Mm-hmm. So those are the things I think about.
Great. And when laws are passed, they sneak in, let me use this in quotes, right? They sneak in other things. And one of the things is that the Affordable Care Act helped the whole market of insurance. It did. So it set some protections, some rules for everyone, not just for the Affordable Care Act or the marketplace. So now, like for instance, there are protections, premium increases. In the past, there was no control of premium. Anybody they could just hire their premiums. Now, anyone that wants to raise it 10% or more, they have to justify it. They also have to spend 80 to 85% of the premiums they get on people's care. That's a protection. And also, no excessive premiums can be charged based on age. It used to be a 5-to-1 ratio. That means an older person would pay 5 times the rate of the younger person. Now, they only allow a ratio of 1-to-3. So one older person, the most they can pay is 3 times more than a young person. And then if you smoke, you get smoked. That means that if you smoke, they're going to charge you 150% of the premium, meaning you would pay this amount. Now, because you smoke, they're going to charge you 150%. So that is part of the law. In the past, if you got sick at some point, you were costing the insurance too much, they could drop you. They could drop. They don't have to cover you. Now it's against the law. They cannot drop you if you get sick. If you have pre-existing conditions, let's say you have cancer and you need insurance, no questions asked. They're not going to ask you anything about your health condition. The only thing they ask you is how many people live in the house, the income that comes in, and then if you smoke, and the ages of people. But they are not going to ask you about your health conditions. Do you already have cancer, diabetes, high blood? No questions asked. That is a huge item of the Affordable Care Act, protection against pre-existing conditions.
I'm glad you answered that, because that was going to be one of my questions. Mm-hmm. Thank you for mentioning that.
And then there are no limits placed on coverage. There used to be an annual limit. In other words, we're going to cover you at this $50,000 a year, just to say an example. Once you reach that, it says, sorry, you already reached your max. You're on your own for the remainder of the year. that's over. And then annuals and lifetime. So that could apply to an annual amount and then a lifetime, and then they can kick you out because you're costing me too much. You're out. It's over. So that's protections. There's preventive services. So everybody can do an annual preventive service at no cost, meaning no copay. And then, that'll be your normal preventive. Young adults, I still have my last son with me, my last child. He's going to be 23. He can remain with me until 26. Once he turns 26, then he has to be on his own. But that's part of the Affordable Care Act. That's why actually I kept my son, my older son, and my daughter, and now this other one, right? So a lot of good stuff. It has an out-of-pocket limit. So when you buy a plan of those 4 levels that we mentioned, there is a max amount that you would have to pay out of pocket in worst case scenario, right? So once you reach that cap, it's over. You don't pay anything more for the remainder of the year. And then there's a program called SHOP, Small Business Health Options for companies. Actually, small companies can buy insurance for their employees in the marketplace. Who's eligible? Well, you must be a citizen, a national, a lawful, have to be lawfully present in the country, not incarcerated, live in the service area. And now the good news, DACA students are eligible to buy a health plan in the marketplace. This is great news. And they give you credits, right? Credits to pay for the premium. Credits is called a subsidy, right? To make the premium more easy to pay. Okay, affordable is the word. And then there's also other types of subsidies on the cost sharing. One thing that I also want to mention is that they allowed the states to raise the threshold for Medicaid access in Arizona from 100% to 138% of federal poverty level. And Jen Brewer, our past governor, she expanded Medicaid in Arizona, which is a great thing. Well, guess what? Now people up to 138% of federal poverty level, they can get an access plan. It's a great thing thanks to the Affordable Care Act. See, the Affordable Care Act did a lot of good stuff. I'm going to have to go quicker. There's, again, advanced premium tax credits, and there's cost sharing subsidies. Let's see, what else can I do? I think I'm going to have to wrap it up. But open enrollment for the Affordable Care Act is a little different than Medicare. It started in November 1st, 2024, and it's going to go through January 15 of 2025. The recommendation is for folks to sign up if they don't have insurance and want to get a plan, or make the changes by December 15 to guarantee that change, that coverage starts in January 1. This is important. And I will leave some resources for folks there, but it's a great thing. Millions of people have now insurance thanks to the Affordable Care Act. And it's always a good feeling for me when I talk about this topic. So there you have it.
I'm glad you mentioned there's online resources for people in case maybe they don't understand something, but they can always call you too.
I am so happy to receive calls and just kind of review these things, and then I'll refer them to those agencies, those persons that can actually help them enroll.
I want to say Happy New Year.
Happy New Year to you.
And I'll see you in 2025.
Yes.
Thank you for all your information. Thank you for being a friend of Arizona Barrio Stories. Thank you for being a part of our familia.
My pleasure.
Thank you also for being a part of Arizona Barrio Stories. His information is something that you might need, or maybe somebody in your family. Don't hesitate to reach out, and thank you again for being a part of this show. I will see you soon. Thank you, thank you, thank you. I'll see you soon.